When did we do this? 6 weeks ago?
I think so.
Yeah, it was just before our vacation in the middle of July.
Yeah, July 8th, I think so. That she screens us. So this is 6 weeks, and that is a great looking scar, with the exception of one PDS stitch that worked its way out, which is that little sore spot up top. The bottom of the scar is really skinny. There's probably a little shock loss right at the edge, and that'll come back. And so we'll check him again next summer. Did the whole thing hurt at all?
Nope.
Yeah, you're tougher than the average kid. So you're a 16-year-old kid that had an IV burn when you were born as a preemie, and it's here at your hairline. And so what we'll do today, there's a couple choices, and we talked about it with your mom and you last a couple weeks ago. You can put hair in that, but you're probably going to lose hair here, and you're such a young kid. So we'll cut this scar out, and then next year, if we need to, put a few hairs behind your current hairline. We can easily do that.
Cool.
Okay, so you're half numbed up. How much, you can be honest, how much did I hurt you during the first half of numbing you up?
I felt it, but like it didn't hurt.
That's pretty good. Alright, so we got your hair greased out of the way. I'm going to do a little more numbing. And that medicine shrinks down your blood vessels, so here in about 10 minutes we'll get started. So I just finished cutting this thing out. And two things happen when you put the specimen back in there. So it shrinks down and your scalp pulls apart. And what you're seeing is it's not bleeding much because of the numbing medicine. And you can lift it out. And so then we undermine on each side and we'll pull it together with a couple layers of stitches. How much did I hurt you when I did that?
Didn't feel anything.
Okay, perfect. Okay, so we got the deep layer way down inside your head end with a big thick stitch. And then that takes most of the load that would pull the scar apart off of the skin. And then right underneath the skin are some smaller stitches that look much like this fellow's hair, right? Didn't that look like your hair when I showed you the stitch?
Yes, sir.
And so now we have the load taken off the skin edges, and we'll put in some stitches that stay in for about 6 days. And you'll probably get a little shock loss on either side of that scar, even though we didn't have to do any cautery on the skin. And that'll recover, and then we'll see how things mature over the next year. Have I hurt you yet?
No.
Great. Alright, so your skin stitches are in. Everything's lined up just right. Ideally, it just turns into one thin little skinny scar, but you're only 16, so it can widen out a little bit. Take it easy this weekend. How much did I hurt you?
Didn't feel nothing.
And you were pretty stressed out coming in here, I think, right?
Yeah.
Easier than you thought it was going to be?
Yeah.
Okay, alright. I'm just going to clean you a little bit.
Don't you say no.
So how much did this hurt this week?
That didn't hurt.
Oh, alright. Yeah. So that looks like it's supposed to, it's been, what, 6 days or 7 days?
7.
7 days.
All right.
Yeah, that's
So start putting a lot of vitamin E on that thing, and see you in a month.
Cool.